I think a lot of times when people are thinking of substance use disorders and people who are addicted to opioids, they're thinking of someone who's much older. However, we know that the majority of addictions and substance use disorders start in the pediatric time frame. And so that's why it's so important as a children's organization and as pediatric providers and as an adolescent medicine provider that we are able to prevent these things from happening, and if they do happen, that we're able to recognize and treat opioid use disorders so that we can get kids the help that they need and hopefully turn a different trajectory so that it doesn't become an even bigger issue when they become an adult. Our partnership with the Alliance is really to help get education out there for those who have kids that are adolescents and young adults that could be at risk for this, so that we can work on preventing someone from really moving down the lines into a full-blown opioid use disorder. So utilizing our partnership to give education to parents and family members and schools and anyone who interacts with youth to give them ideas of how to recognize signs or symptoms in their adolescent or young adult that could be an opioid use problem, how to work on preventing an opioid use problem from happening, such as talking to your kids about drug use, locking up medications, monitoring medications that are in your home. Overall, when looking at things, the number one thing that should happen is just there needs to be a reduced stigma about the problem. The Denial Ohio campaign, I really think, says it best when they're like, it can't happen here, or, my kids are good kids, or we're not the type of people to this to happen to. And that stigma that this is only something that happens to people who are bad, that this is something that is something that someone asks upon themselves, really needs just to be squashed, because that is a huge hindrance to people asking for help, to people acquiring help, and to people even recognizing that it could be a problem that could affect them.